Okay, so this video is going to look at adult and aged athletes. This is our second dot point for how does sports medicine address the demands of specific athletes in sports medicine. So our syllabus here says that adults and aged athletes, we have to consider heart conditions, we have to consider fractures and bone density, and we also have to think about their flexibility, which is also known as joint mobility. With that knowledge, we then have to apply it, and we have to explain the sports participation options that are available for aged people, particularly with these conditions. So what choices do they have for sport if they have these kinds of medical conditions? So our first one is heart conditions. People with heart conditions, that's going to include things like people who have high blood pressure, a number of cardiovascular diseases, angina, so that's when you have pain in your chest pain as a result of movement and exercise, essentially because part of the artery is partially blocked. Survivors of heart attacks are going to be in this category, and so are people who have heart valve disease. So these people, generally any kind of condition that relates to the heart, they're the people we're talking about. With heart conditions, the American College of Sports Medicine have a range of recommendations. So first of all, you have to send the athlete off to be approved for exercise by their GP. So often the GP will then send them off to a specialist to get a bit more of an idea of whether or not this person can do exercise. And often that approval will come with limitations as to how much the intensity can be set and whether or not they can do resistance training and stuff like that. When they do come back, you then have to, when you're applying any kind of exercise program for them, you need to make sure you include a 5 to 7 minute warm up and cool down at either end of the training or sports session or exercise. You never want to have them exercising to the point where they start to get any kind of chest pain or angina, because that means that you're putting too much stress on their heart and you might actually cause them to have a heart attack. So never exercise to the point of chest pain or angina. Exercise with a friend in case of emergency, so you don't want them at a gym by themselves or going for a bushwalk by themselves or something. You want to make sure that there's someone around them. Mostly at gyms there's normally people around because there's staff who work there and stuff who can look after them, but generally speaking, not by themselves. You want to make sure that they stop if they start to get dizzy, if they're nauseous, if their unusual shortness of breath occurs, and then if they start to feel like they're having irregular heartbeats or angina or anything like that, they need to stop immediately, and then they'll probably want to make sure they go and see their GP in the next couple of days to make sure that they get checked up and make sure that they're okay to keep going. You want to avoid putting them into an environment that also adds stress to their body. So you don't want to have them doing exercise and sport and stuff if it's too hot, if it's too cold, or if it's really humid, because those conditions add stress to the body. And if you're adding stress to the body, that can then mean that they're going to be exercising at their normal kind of intensity, but they're going to start to experience that dizziness and nausea and stuff, or possible chest pain. So you want to avoid that. Those environments that add extra stress. It's recommended that people with heart conditions do 5 exercise sessions a week of about 30 or more minutes, and generally that's going to be moderate to light intensity. They can do some light resistance training. You don't want to have them doing 1 RMs or anything, because that will cause a lot of stress on their heart as blood pressure goes up massively when you start to do lifts like that. But if the lifts are more than their 10 RM, that tends to be a bit more of a lighter resistance for them. They still get lots of benefits from it in terms of strengthening their muscles and their bones and stuff. And then in terms of their sports options, so remember the application of this is to explain the sports options available. So we're looking at that low, moderate intensity levels of exercise. So that's things like golf, cycling, tennis, dancing, going for a brisk walk, doing some kind of aerobics, but just keeping it that low to moderate, so not moderate, high intensity kinds of exercise. You want to make sure that exercise is low to moderate intensity exercise, and they're just a bunch of examples there. When it comes to fractures and bone density, so people who have poor bone density are going to be more likely to suffer a fracture. So that basically, your bone density is a measure of your bone strength. It's a measure of the mineral content in it, and if it's got less minerals, then it's quite weak and more likely to break. You can see in the pictures down here, the ones that have poor bone density are the ones here on the right, where you can see that they're kind of hollow and they look like they're going to break. So if it's a normal bone that doesn't have that kind of hole in it, that's nice and solid, it's dense, and then it's stronger and less likely to break. What makes you more prone to having poor bone density? Okay, so if you're a female, you're more likely to have it, particularly if you have early onset of menopause or something like that. If you have a small body size, that makes you more likely to have poor bone density. If your diet is not adequate or you're doing poor levels of physical activity, then again, your bone density levels are more likely to be lower, and that means that you are more likely to suffer fractures as a result of falling over, running into someone, or even just participating in high intensity or particularly high impact kind of sports. So if you're doing road runs, for example, that's a high impact sport, constantly having high levels of impact going through particularly your ankles, your feet, and your shins. And so that means you're more likely to get something like a stress fracture or something in your shin or in your foot as a result of having poor bone density and that constant impact that's occurring. In terms of sports participation options, these people, they want to avoid contact sports. So if you've got poor bone density and you're more likely to break your bone, you don't want to go and play rugby league because you're more likely to break a bone playing that than you are if you're off doing cycling or walking or something. So you want to give them sports where they can still enjoy themselves. So golf, tennis, swimming, things where there's not a lot of high impact and stuff where there's not a lot of contact within that sport. Even tennis, there can be a lot of running and changing of direction with tennis, so it would depend on the level of that tennis, I guess. Recreational tennis tends to be a lot lower impact, and tends to be something that people with low bone density can participate in a lot more easily. Fractures and bone density, there's lots of beneficial sport options for people who have poor bone density, particularly resistance training and weight-bearing exercise. So weight-bearing exercise is exercise where you're walking, where you're carrying your body weight the whole time. So if you're walking, running, jogging, all that kind of stuff, anything that involves you moving around, going for a hike, etc., with your whole body weight on your bones helps to improve your bone density. And that's why resistance training helps as well, because you've got that extra weight, that extra stress that's being placed on your bones, which then causes them to add that extra mineral to your bone to strengthen it, because they can tell that there's a stress that's happening and your body responds to that stress. Obviously, you don't want to have your resistance training being, the 1RMs and stuff. You want to keep them at a decent level RM, so probably 10 plus, still kind of like the heart conditions, just to make sure that you're adding enough stress to cause the adaptation, but you're not causing so much stress that you're actually going to cause a fracture. If someone does have a fracture, you want to make sure that wherever that fracture is fully healed before you use that area of the body again. So sometimes that can be really limiting, because if you fracture your foot, for example, and you can't use your foot, and then that means you're limited to your hand motions, because it's very hard to do one-legged kinds of things, particularly if you have low bone density. And so it's very important for these people to make sure that they're doing things that only give them enough stress to cause adaptation to improve bone density, and that the stress is not so high that it's going to cause a fracture. The next one is flexibility and joint mobility. So joints, basically their ability to move through its full range of motion is often referred to as flexibility or joint mobility. The two terms are very interchangeable. Often though, flexibility can be used to refer to multiple joints or the whole body. We don't generally talk about, the whole body's joint mobility. We talk about the whole body's flexibility. But we also can talk about specific joints flexibility, so the hip joints flexibility. And that's also the same thing as saying the hip joints mobility. So flexibility can be very specific or very general, whereas joint mobility is always specific. It's always referring straight to that single or possibly even two joints at a time. Now, changes in flexibility and joint mobility for aged and elderly athletes and stuff, they only occur if you stop using it. So you're going to become less flexible if you stop doing motion that requires that flexibility. So if you used to be really good at yoga and into yoga for a long time and then you stop, then your flexibility is going to decrease as a result of you no longer doing those movements. Whereas if you continue to do those movements, you actually won't lose any of your joint mobility or flexibility. You'll end up possibly even improving it still, because you're still constantly using and extending that flexibility, that joint mobility by doing those exercises. So then, of course, it's no surprise to see yoga and Tai Chi down the bottom there as sport options that are actually quite beneficial for people with flexibility or joint mobility problems. But generally speaking, people who have poor flexibility or joint mobility, they're not limited in their choice, but they should make sure that they slowly progress in intensity. You don't want to go and start doing really high intensity movements, particularly if those high intensity movements also require a high level of flexibility. You're pretty much going to guarantee that they're going to get themselves a muscle strain. So it's very important for them to slowly progress in that intensity and slowly progress in that joint range of motion, so that they're slowly increasing their flexibility and not just having it all dumped on them at once.